I think we can get started, Pam.
Okay, thank you. I want to thank everyone for joining us this morning. We're here to meet about mitigation, prevention, and providing business support. I'm Pamela Lopez-Fettis, Executive Director to Growth Dimensions, the economic development arm for Belvidere and Boone County. I want to thank you again for your time this morning as we discuss this. Forward Boone County is putting on this webinar as the positivity rates for COVID-19 has rises. We've wanted to feel that we're providing you with information and support. We're joined today here by the Boone County Health Department, and they're one of our partners with Forward Boone, and they're here to answer questions and ease and concerns. As a reminder, we want you to please mute yourselves. We'll hold a question and answer period after the presentation. And you'll have the opportunity to answer, get some questions answers. We're also going to be recording this webinar in order to provide that information so you can share this information with others. First, I would like to take this opportunity to introduce Forward Boone County. It's a group that came to be in April. It's dedicated to a group of local leaders and organizations working together, dedicated to combat the impacts of COVID-19. These partners are working together to make Boone County stronger together. There's also a website to gain more information about this. It's www.forwardboone.org. Now let me introduce to you our guest this morning, Amanda Meal. Amanda has worked in public health for 15 years and currently oversees the operations of Boone County Health Department in Belvidere, Illinois as the Public Health Administrator. Amanda has her master's in public health, and she has had some studies in the areas of nursing, public health, gender studies, and linguistics, as well as unique international cultural internship experiences abroad. So she's very motivated to address the population's health at the local level, and we'd like to welcome her to our webinar this morning. Thank you, Amanda. Amanda? I'm sorry, I think we're having some technical difficulties.
Yeah, I think first somehow she got disconnected. I think we're trying to get her back in.
Okay. After Amanda speaks, we're going to hear from the Belvidere Area Chamber of Commerce that has some resources available for businesses. And I see that Amanda has rejoined us. Amanda?
She's muted. Fine, excuse me. All right.
Thank you, Amanda, for joining us this morning.
All right. Let's try this. Can everybody hear and see me okay?
Yes, we can. And I think we lost you again. We're having some blocking.
I'm thinking there may be some connectivity issues.
Yes.
So she can get back in.
Amanda, can you hear us okay?
She should be on.
Mm-hmm.
Maybe Pam, do you want to talk about what the current situation is, maybe, you know, why we're all here today?
Well, we're all here today because the COVID numbers, 19 numbers are rising. And we're trying to not react to these numbers, but we want to help prevent the numbers from rising any further. I see Amanda is back on and she can explain that a little bit further. Amanda?
Hi everyone, I'm so terribly sorry for the technical difficulties. I'm actually going to be using Ellen Genrich's alias here. I'm sitting at her computer because there were some issues with my connection on my camera. So my apologies for the hold up here. Pam and Heather, thank you so much for hosting the health department here on this forum. So we just want to make sure that we're providing timely and accurate information, not only to the community, but also to our business owners, our restaurants, our bars, our daycare facilities, our other small and medium-sized businesses here in the county, so that you all are aware of what we're seeing at the county and the regional level. So one of the roles of the health department during the COVID-19 pandemic is to review and push out numbers that are being generated at the county level and then at the regional level. So at the regional level, we are part of the Rockford region. So there are 9 counties and 9 health departments that encompass our region. So just to give you just a very brief overview, because we really want today's focus to be a little different than the call that we held and recorded on Friday. We really want to do some proactive brainstorming today. So let me just clarify that at the county level, we have 2 counties in our region who have turned into orange status for this week, and that is Boone and Winnebago counties. So to be in orange status, we have to have several of our metrics or our data points that we're tracking weekly be out of whack or be out of range for what we're looking for. So what we're watching for is new cases. We're watching for test positivity at the county level. We're watching for COVID-like illness, individuals who are being admitted to the emergency department, COVID-like illness admissions to the hospital, ICU bed availability, death rates, clusters, so groupings or hotspots or outbreaks in specific areas or sectors within the county, and then number of tests performed. So what's our testing capabilities? So our numbers are out of whack or out of range, unfortunately, for several of these metrics. So we're going to be in orange status for the remainder of this week, along with Winnebago County. The other issue that is concerning at the regional level is we are watching our positivity rate creep closer and closer to 8%. So as of yesterday, when I checked around midday, those numbers come out daily. There is a 3-day lag. So the numbers that came out yesterday afternoon were for 3 days prior, and we were at 7.9%. So once we get to 8% or above, and we sustain a positivity rate of 8% or more for 3 consecutive days, then our entire 9-county region will go into what we call regional mitigation. And this is part of the Illinois Restore Illinois plan through Governor Pritzker's office and the Illinois Department of Public Health. And there are 2 other regions in the state of Illinois that have either been in regional mitigation or still currently in mitigation. Region 7, which was the Will and Kankakee area, and then Region 4, which is the Metro St. Louis area down in South Central Illinois. Region 7 has come off of regional mitigation. They have been able to get their positivity rate back down and sustain it at a lower rate. Region 7 still continues to combat a pretty high positivity rate. So once we go into regional mitigation, the information that has been provided to the other 2 regions, I do not have official information for our region because we are not there yet, but we want to have an open and honest conversation with what we can expect if we do end up in regional mitigation. So the mitigation requirements for bars would most likely be as follows. All bars close at 11 p.m. and may reopen no earlier than 6 a.m. the following day. No indoor service. All bar patrons should be seated at tables outside. No ordering, seating, or congregating at the bar. Bar stools should be removed. Tables should be 6 feet apart. No standing or congregating indoors or outdoors while waiting for a table or exiting. No dancing or standing indoors. Reservations required for each party. No seating of multiple parties at one table. As far as restaurants go, the mitigation requirements would be as follows. All restaurants close at 11 p.m. and may reopen no earlier than 6 a.m. the following day. No indoor dining or bar service. Tables should be 6 feet apart. No standing or congregating indoors or outdoors while waiting for a table or exiting. Reservations required for each party. No seating of multiple parties at one table. Then for meetings, social events, and gatherings, which includes weddings, funerals, potlucks, etc., Mitigation measures would be as follows. Limit to lesser than 25 guests or 25% of overall room capacity, both indoors and outdoors. No party buses, and gaming and casinos close at 11 p.m. are limited to 25% capacity, and follow mitigations for bars and restaurants if applicable, depending on where that social gathering is taking place. And then for organized group recreational activities, we would continue to follow the Illinois Department of Public Health sports guidance, which became effective on August 15th, 2020 and remains in effect. Outdoor activities would continue to follow current DCEO guidance. And this is the information that we have available based on the mitigation measures that have been placed on other regions in our state. So that's a very brief overview of the concern for our rising numbers and some of the work that we will need to do here additionally as a community. So I will say that from the health department standpoint, we are bringing some mobile testing sites here to the community in the coming weeks. We will provide those testing sites both here in Belvidere and then also up in the northern part of the county. The goal would be to get more individuals tested so that we could have a better pulse on our positivity rate. We want to test people who are not just showing symptoms or feeling ill. We know that we have a large segment of our population who have COVID-19, who are positive for COVID-19 and are asymptomatic. And that is concerning, of course, because if they are out and about and do not realize that they're carrying the virus, then they can unknowingly spread that to others. So with that, Pam, I think I'll turn it over to you. Really what the health department is wanting to achieve with this call is we want to make sure that our businesses are aware of this concerning situation, aware of the increase in the numbers, aware of what we might be faced with as a region if we do go into regional mitigation. We know that this would affect your respective businesses and organizations, and we want to work with Growth Dimensions and the Belvidere Chamber of Commerce and other leaders to figure out what can we do to help our businesses through this. What do we need to do to promote the work that you're doing, to help you to do additional things and to assist with business functions as much as possible during what could be a few steps backwards in the process that we're seeing. Pam?
Thank you, Amanda. Now, nobody wants to go into medication. So what can our community do in order to respond to this quickly? If you can cover, what are some of the things that we can do in order to prevent these numbers from going up?
Yeah, so we really need all hands on deck, if you will. We need the general population to assist. Because we don't want our businesses to, carry the heavy burden of regional mitigation with the limitations that would go into effect on their operations. We need people to be wearing a face mask every time they leave their home. We need people to be wearing that face mask when they're out and about, when they cannot maintain that 6 feet social distance. We need people to be watching their distance at all time when they're in businesses, even when they're using essential services. So gas stations, grocery stores, places that will remain open and will not necessarily have specific restrictions placed upon them. If we do go into regional mitigation, we need to make sure that we're staying 6 feet away from everybody around us, right? And then washing our hands. I know that just sounds so basic, but it really does help to spread spread viruses such as COVID-19 and other viruses as well. So warm soapy water, 20 seconds, 20 to 30 seconds, our favorite childhood song, Twinkle Twinkle Little Star, Happy Birthday, you can pick, and really scrub in between your fingers and get in there really good. That really does make a difference, right? So we call those our 3 W's: wear a face mask, watch your distance, and wash your hands. The other thing that we're going to encourage people to do is plan ahead, make smart choices about where they're going. If they arrive in a situation where people around them are not wearing a face mask, then we would ask them to feel comfortable leaving that situation. We would ask them to please give us a call and let us know if we have businesses that are still struggling to comply with what has been set forward as far as the masking requirements and the social distancing that's being asked to be, marked on the floors or the walls or the entryways of businesses to instruct people where to stand and how to spread themselves out. We need to know about this so that we can work even more closely with our businesses. Extremely important.
Thank you, Amanda. I see that we have Amy Grafton, Executive Director to the Belvidere Area Chamber of Commerce. Amy, can you share with us some resources that are available for businesses through the Chamber and through Forward Boone?
Yep, absolutely. We know that this has been a really difficult time for businesses, and as different assistance becomes available, like you had mentioned on Forward Boone, we are putting links to the different grants and loan programs that are available through the state and bank funding. So this has been one of the things that, I mean, it's been ongoing and changing since assistance has become available back in April, I believe. There was just another wave of the big grant that was made available last week. So applications are available, and there's a link on the Forward Boone County website. This particular grant has been expanded to different types of entertainment. Before, it did not include movie theaters, entertainment, businesses like, for instance, anybody that holds concerts or relies on event ticketing, things like RVC has the outdoor theater, so things like that, that it has really broadened who's able to take advantage of that big grant. So that is the latest assistance that's become made available. And there's also $70 million that's been set aside for specific zip code areas. So that location is also, you're able to look up your location to see if you're in that area on the website as well when you click on the application. So it thoroughly explains everybody that's included in it and how much is available. And actually, this grant is so much easier to apply for than the previous loans for the PPE ones. So if anybody needs assistance or further explanation of what's available or how to apply, or if they meet the criteria for it, please call the Chamber. We are happy to walk through this with you and just let you know how you gather your information, how you submit it. The wait period is about 4 to 6 weeks, which I know is a long time to wait, but if that pans out for you and your business, I mean, it could be really extraordinary. We have a handful of businesses already in the Boone County area that received funding from wave 1 of the grant, and most of them received $20,000 a piece. So that could be your payroll, your rent. It's really big. Hence the big grant.
There's a number of people, especially with the holidays coming up, are really concerned about, you know, where people are shopping. What is the Belvidere Area Chamber of Commerce doing in order to help enhance that shopping local?
So we actually, for our chamber members, we have a new e-commerce system that's available to our members, and they can place items that they have for sale on this e-commerce page, also available on the web or on the, the phone app. So we're trying to help our businesses, for people that don't have an online website and are able to do online shopping. We are assisting our members in providing this service. So it just gives some additional opportunity for them. But we are encouraging, like I said, everyone to shop local, everyone to, you know, put your money in the businesses in your community, because these are the businesses that are, you know, hurting the most. And, you know, we all love Amazon, but it is important to shop local and keep our community thriving.
Wonderful, thank you. I see that we have some businesses on. There's, you know, sometimes hearing what a business has done and how they had made adjustments through, you know, and stayed in business from the beginning by keeping their doors open, and hearing different strategies on how we can maintain, you know, our business in this very difficult environment. Can we hear from some businesses that maybe had dealt with maybe the essential workforce or kept their doors open, and maybe hear some examples? Maybe Russ? Thank you.
I am muted here. I hear about the mitigation here, and I think in general, Belvidere and Boone County has adapted to the mask issue, the social distancing issue. you know, when I see the mitigation, I'm not sure how well that in general is going to work. It looks like the heavy lifting is put right back at the bars and restaurants. And I don't know, I can't speak for everyone in town. I will tell you that in the last month, in September, since the kids basically started school, our sales have dropped better than 30%. We have been able to eat inside for almost 2 months. You guys would know exactly what that date is. We have 6 tables, I think, 7 tables at Firebox, 3 tables at Shortline, and I don't know, 4, 5 at Sips, you know, in the front. And we've never run out of tables. There's always been empty tables. So to think about the fact that we're going to cut that down even further doesn't make a whole lot, I don't think that's going to move the needle, because we don't have enough people in there to worry about social distancing to start with. You know, you look at Walmart, you look at, you know, some of the Fiesta Market, you look at Pacemakers, I mean, let's just run down the list here. And you've got hundreds and hundreds of people in there, and we're not going to mitigate those stores to change their way of doing business. Yet you take a restaurant that only has 6 tables and they're not full, and you're going to cut that down further. Seems a little unproductive to me. The other thing is Hidden Airy, which of course is our venue space, has had a whopping 2 events since we've been able to have events, because nobody's participating. We've had it booked, and they've, at the last minute, all but 2 have canceled because no people are coming. You know, the RSVPs are way down. So we've had a baby shower of about 30 people maybe, and I couldn't tell you how many were on the other one. It certainly was not full by any stretch of the imagination. Now, and so as far as, I don't know now that winter time's coming, if the bars are going to be more full or not. I will tell you, in our experience, if people have to eat inside, they're just not doing it anyway. When it gets to be cold and rainy, there's just nobody in the restaurants. So it's not like they're moving in from outside to come in anyway. So I think the county ought to look at some other way to try to mitigate, to put all your hopes on the fact of minimizing gatherings at like Hidden Airy or the restaurants is probably not going to move the needle. I don't know about my question, I guess, would be, and I agree with Amanda, the more people we can test, we can drop our numbers down. The more people we can test negative will help push that percentage down. But the first time that I had ever seen, you know, basically free drive-up testing in front of the county building was, I think, last week or so. And they were there for several days. Had not seen that yet, and all of a sudden we have that testing, and all of a sudden we're in the orange. I'm not sure if there's a relationship to that or not. But, you know, I think we ought to look beyond that, because I do think the citizens in Belvedere are certain, and again, I don't know about Poplar Grove, I don't know about the outlying areas, but I do see mask compliance way up. I do know that our staff, we had a hell of a time with our staff trying to get them to wear masks, and pretty much everybody is now. And when I was eating at Firebox over the weekend, I think everybody but maybe one patron had come in with a mask, which I thought was a huge improvement over what we had been having, you know, lately. So, you know, I'd be interested to hear what the county has to, you know, what their outlook is, because again, I don't know about Coach's Corner and some of the other restaurants, but, you know, our sales are bleak to start with. So I don't know that cutting us down is going to move the needle a whole bunch.
Thank you, Russ. Amanda, please chime in, but are these local mitigation, or is it a state mitigation requirements?
These are state level mitigation measures that are implemented at the regional level when metrics are out of whack, or when the positivity rate goes at or above 8% for more than 3 days. And so the mobile testing units were deployed a couple of weeks ago because we spent a week as a county in orange status. Then we did go back to blue, which is, you know, all metrics or all but one metric are are within the range. And then now we're back with 3 of our 8 county metrics that are out of whack, which has pushed us back into orange. So we do get offered mobile testing sites when rates are climbing. So that is in response from the state to a situation locally or a situation regionally. We won't be given a choice on these mitigation measures. These are part of the Restore Illinois framework. I will say that in talking with my colleagues who work in the greater Will and Kankakee region, and also down by Metro St. Louis, that these mitigation tactics have been successful in moving the needle. I do have, of course, I share concerns with what's been brought up on the phone with larger chain stores and larger corporations that have really, really strong online presence and lots of resources to make those activities happen throughout the pandemic, are definitely positioned better to weather this storm than our local businesses. So I do share that concern. I will say that I have voiced that concern along with some of my colleagues up to the state level. We've also talked with the state on numerous occasions about how challenging this is for rural communities when you have lots and lots of small businesses that are really in our community alone. So we'll continue to voice those concerns. I will say that bringing testing to the area and limiting bar and restaurant operations has successfully moved the dial in those other 2 regions. I don't think it's the only tactic. I think that there are other things that we could and should be doing. Really, the reality is that this is my best prediction on what will be given to us if we do sustain a positivity rate of 8% or above for 3 days or more.
Thank you, Amanda. I see Jen Jackie on the line from the YWCA. She had also developed some strategies in order to keep those numbers down from the beginning of COVID. Jen, can you share some strategies that may be beneficial for other, providers of care?
Sure. Yeah, I mean, we have successfully stayed open. We definitely pivoted our services quite a bit during this time. We've taken a very strict line looking at what DCEO's guidelines. Those have been extremely helpful. And then also working with the health department as just a sounding board. They're very easy to talk to. And make sure we've done things, we've required masks this whole time, and are very strict about people not being able to come in without them. We do have extra masks though on hand, because we do know people forget their masks. We have, as a gym, obviously it is easier, people working out, they do not wear their masks, but we have our equipment spread out the appropriate spacing, if not more. Additionally, when everyone comes in, we give them their own bottle of sanitizer, and we ask that they clean their equipment that they use beforehand, and before they use it and after they use it. And then along with that, we have the staff going around cleaning very diligently. We have successfully moved up to 4 rooms of childcare. It is much different. Usually, we have 60 kids all in a room together. We are at the point of being able to have 15 children in each room. So we do that. It is, I feel like a broken record saying pull your mask up to the children, but the kids, honestly, the younger kids are the ones who follow the rules a lot better than the older, especially teenage boys. So we have been very fortunate in that it does take a lot of extra time and a lot of extra patience with the kids, trying to explain to them of what the reasoning is behind it and that sort of thing. But we've been very lucky. We also have been lucky enough to receive some of the grants in the area to be able to support our services. But again, I think the key thing that happened, that we've been able to navigate this, is the fact that we know we have a sounding board with the health department, and that they are willing to kind of talk through the the different ideas that we have.
It sounds like the health department was involved in some of the strategies that you were developing, Jen. So you encouraged that, you know, businesses maybe contact the health department if they had some questions, and if you had some unique ideas in order to present, in order to carry out your business.
Yes, absolutely. We've done everything from different safety plans to, you know, welcome back handbooks for the members, and they've always been, you know, gracious enough to review it, give suggestions, you know, and different tips that just to make everybody even safer.
Wonderful. I'm going to open this up for questions. Does anybody have any questions? You can go ahead and unmute yourself and ask your question. If you're not capable of voice, you can put your question in the chat box.
I'll start. I have a question about the mitigation process. I noticed within the mitigation process, there's 3 different tiers. So once we, I shouldn't say once we, I'm sorry. If we hit that mitigation process, would we then start at tier 1 and move through the tiers through the 14-day period, or how does that exactly work with the tiers?
That's a really good question. That is the way that I've seen it rolling out in the other 2 regions. So Region 7 has successfully brought themselves out of mitigation. They were in mitigation for 3 weeks, I believe. And Region 4 down by St. Louis continues to be in mitigation. So they had a series of tier 1 requirements put on their region. And then at the beginning of September, after they had been in mitigation for a series of weeks, then they had some additional mitigation measures that were put into place. So they have entered into like the next phase of mitigation. Their numbers have come down significantly, but they are still struggling to get down underneath 6.5% and then sustain that for 3 days. Some of their counties, their individual counties have done an excellent job of getting there, but it has to be the regional positivity rate along with the other metrics, not just one individual county.
Thank you, Amanda. We actually have a couple of questions in the chat box. Well, first, are businesses required to force customers to wear masks when they enter an establishment?
So it is the current requirement in the state of Illinois that the general public wear a face covering when entering a public place, right? Whether it be a business, whether it be a government office, wherever it might be, when 6 feet is not able to be maintained. So we would ask our businesses to ask individuals to put a face covering on if they enter without one. We do have boxes of masks available here at the health department that we would be more than happy to provide to businesses if you all need some additional boxes of masks. What we don't want to happen is to have a situation where you would be concerned for your safety or that a confrontational situation would escalate. So if there would be any concern that the patron entering were to become hostile or was going to become an escalated situation, then we would ask you to please involve local law enforcement and to please report that information to our office so that we can assist you with it.
Thank you. What outreach efforts have been done to reach the Latino and Hispanic population?
Well, we have put all of our materials out in English and Spanish. We do have Spanish-speaking staff here available to review safety plans in Spanish, to speak with a Spanish-speaking patron and or business owner over the phone or in person at a safe social distance. One of our inspectors speaks Spanish, and our COVID-19 information line and email is staffed by Spanish-speaking individuals. The majority of our contact tracers are bilingual in English and Spanish. And our next project, which we're really excited about, is we're doing some GIS mapping, some geographical mapping of the county, looking at target hotspots. And one of our primary target areas is going to be communities where we have larger numbers of Hispanic Latino families living, so that we can actually send some of our staff out to do some additional outreach. We're hoping, as we bring more and more testing to the community in the coming weeks and months, to partner with some of our Hispanic business owners and possibly bring those testing sites to parking lots of Hispanic businesses.
Thank you, Amanda. Can businesses be shut down because not every customer coming through the door is wearing a mask?
So that's a really good question. I'm sitting in a different room from my environmental supervisor, Michelle Gibson. I can field that question, but I also would like to give her an opportunity. Michelle, are you on the line?
Yes. So anytime we get a complaint or anyone comes out to, or someone says that they have seen customers or employees not wearing a mask, we do take time to investigate that. We also take time to send out educational material, either in person we will drop it off, or by email. And we go through whatever the complaint was with a business owner or representative. And then if we repeatedly continue to get complaints, we'll come out again. We'll come out up to 3 times. And depending on if these are, an isolated incident where one person wasn't wearing a mask and then 3 weeks later another person wasn't wearing a mask, it may not be such a big deal. But if we have pushback from our businesses stating that they choose not to enforce mask wearing, then we may have to escalate things to our state's attorney's office, but that would be after excessive violations and complaints. So for the most part, we haven't really had any businesses that have given us too much trouble. So we're trying to do our best to start with education, and then after several attempts of education and other forms of dealing with the situation, then we may escalate it. Yeah.
I would just like to add to that and say that we can't do that alone. We have a small staff and limited resources, just like many of you on the line. So we would really appreciate eyes and ears on the situation, and also for you all to let us know what trouble you're having with patrons. So I participate in regular state health department calls where I can bring up issues that are happening at the local level and concerns that we might have, and voice those concerns forward. So if there are things that we can do better or differently from the health department standpoint to help you all, and if you all can assist each other, that would be great. If you have ideas on the best way to deal with a disgruntled customer who walks in and you politely ask them to wear a mask and then they give you a little bit of pushback, we know that that is not a pleasant situation to find yourselves in. And maybe some of you have figured out some creative ways to really encourage people to comply with the requirements and continue to be safe. I know that us asking you to do this is not just the easiest thing in the world. It's easy for us to say, okay, now you'll need to do this and this and this. And then if we go into mitigation strategy, you'll have to do this, this, and this. And once the guidance comes out, then it's going to change 5 times in a week and it's going to be confusing. Like, we understand that we're not making this easy. So we would very much appreciate knowing how we could assist you all.
Pam, I've got a comment here if we got.
Yes, go ahead, Russ.
Because most people know, I'm not sure who all is watching, we operate the 3 restaurants in town, Sips, Firebox, and Shortline. In general, we have the same problem of the comment there. What do we do with a customer who doesn't want to wear a mask? And obviously I have 3 times the exposure. So I have 3 times the contact with the health department, and Michelle has been out. The issue we have we have got the staff pretty much in shape, understanding that they have to wear a mask. Customers are, as we pointed out earlier, are fairly good about that. We still have some people who do not want to wear a mask. I did have a question for Michelle on the application of the restaurants. Originally, we were under the impression that everything really should be throwaway items, nothing on tables, ketchup bottles, all that kind of stuff. I do see, in some of the restaurants that I've been in Winnebago and even some in Boone, that they're half kind of back to business as usual with regular silverware and plates and things on the table. Has that changed, or is that going back to throwaway items?
It is more of a suggestion and a recommendation than a requirement. We would ask that you use as much disposable items, as many disposable items as you can, but in instances where it's not feasible, it's okay as long as you're sanitizing according to the normal restaurant guidelines for sanitizing those materials. It's more so for the things that customers are going to be touching repeatedly. Like if you have a stand that's going to have straws and sugar packets and things like that, that's, where there's multiple touch. And but I would say that try to do it as much as you can. I understand that it would probably get expensive, but just be very cautious about keeping things sanitized and using disposable where possible.
Okay.
Thank you. Before we get into our next question, I do want to share that Melissa Erickson with the Community Foundation also indicated that they do allocate grants to the FLAP Farm Workers and Landscapers Advocacy Project for outreach, education, support, and financial assistance to the Latino and Hispanic population as well. So we'll actually provide that link to those resources on Forward Boone after today's webinar. And the next question we have is if we do get into mitigation, what do we need to do to get out of it?
Oh, guys, it's a lot of work. So here we go. So once we're in mitigation requirements as a region, in order to have those restrictions removed, the entire region has to sustain a positivity rate of 6.5 or below for 3 days at least. So the reason behind that is they don't want regions yo-yoing back and forth between being in mitigation, not being in mitigation, being in mitigation, not being in mitigation, because going back and forth would I believe, be even more detrimental for local communities. So once we're in mitigation, we don't just have to drop below 8, we have to drop below 6.5, and we have to hold that for 3 days. So it's not just up to us in Boone County, it's up to all 9 counties in our region. I know that the administrators of the health departments, the 8 other administrators, and I have been tirelessly working. We spent good chunks of the weekend reviewing things and talking and going back and forth amongst ourselves as to how can we really, really work with our respective communities to give clear information and figure out what we can do if we do end up in mitigation. But it's a long climb back down the hill. I'll be really honest.
So I've just had another question, Pam. So we've been talking about Winnebago and Boone County. So irregardless of this, if it's not Winnebago and Boone County going into mitigation, it would be the whole region?
Correct. So
then even if, we're the only 2 counties that are in the orange, so we're going to drag down the whole region?
Yes. That's what's currently happening, yes.
So then the whole region has to stay clean to get us out along with us.
Yes.
Ooh, that is a bigger task.
Yes. Mm-hmm. It's a heavy lift. It's a heavy lift, which is why we want to be talking about this now and not when we receive the press release from the governor's office that we're in mitigation, because we can be doing things now, right?
Okay. Well, when we started talking about Winnebago and Boone, I guess I didn't realize that the whole northern corner of the state is going to go down into this if this is what happens.
There's another question, Amanda. The establishment I work for has been given our final warning without actually receiving the first warning in writing. We have postings on our doors, and masks are required. We have actually for fist fights in our parking lot between patrons and about masks. How are we supposed to keep our staff and other customers safe? And how are the police going to handle any calls for assistance with mask issues?
Just to speak up, I would like that person to reach out to our department personally so we can talk about some issues and maybe just clarify some things. And then we can kind of get more into a discussion of how to help, because it sounds like a pretty unique situation and maybe one that we weren't aware of as far as what has happened with customers and patrons as far as wearing a mask. So could you please reach out? I'll put my number in the chat, but you know, we're really sorry that that has happened, and that's not where we want to go with this. We just want to make sure that we encourage people to wear masks to protect the community. It should never be a fist fight or anything like that. We have not involved the police so far at all in any of our follow-ups on mask complaints, and we hope to never involve police. So yeah, definitely reach out to me and we'll talk about it from there.
And I want to speak for the health department, but I think I speak for the community that safety is our first concern across
Absolutely.
the board. So yes, please reach out, and we want to make sure that everyone is safe, whether or not it be health or you know, any kind of violence.
So our information line is not just for members of the general public to call and complain about businesses. Our information line is also for businesses to call and say, listen, we're concerned about safety. We're having some issues with customers. We're really having a problem with the flow in our facility. We're really struggling with XYZ component of implementing the guidance. Our services are open to you all as well. So it goes both ways. So customers can call and complain about you, but you can also call and say, we're really having an issue with customers, and here's where the problems lie, and how can you all help us? And that is a huge piece of what we need to be doing. So help us to know how we can help you.
Absolutely. Do we have any other questions?
Well, as a business for the health department, I would like, you know, it goes two-sided here. You know, again, we go back to the fact that we have not, our business is down by 1/3, and we don't have patrons in our establishments. So I'm not sure that the public understands that it is safe to go out to an establishment that is following the guidelines. I would like to have a problem with people waiting outside for a table. You know, so, and I think it's more of an understanding. There's so many people wanting to stay in to help our situation, but it depends what situation we're trying to help. You know, we haven't had the information out that it is okay to go out to an establishment that is following the guidelines. So a little of that both directions would be beneficial for us, I would say.
Mm-hmm.
Great. Yep.
And there was one, I don't know if it's a comment or a question, but they've seen people that go into the county building on Logan Avenue that have not worn a mask. And how do you encourage people to wear a mask or make it mandatory?
So the same rules are going to apply to government offices, and I'm very happy to be candid with this audience and make sure that you all are aware that we have received complaints about government offices and concerns about masks, and we have visited with those departments. We have provided the same education and information and guidance and requirements that we would provide to all of you. If you all continue to see non-compliance in a government building, or continue to see non-compliance in another within another sector where you happen to walk into a facility and the compliance is not being achieved, will you please let us know? And then the same rules apply, the same process of making our 3 attempts and doing our education and providing materials applies to public sector as well as private.
And I apologize to the person who asked that question. Obviously I had misspoken. They indicated, asked me to read this as is. You just said encourage people to wear a mask. So how is it mandatory that we require our customers to wear a mask? The county building on Logan Avenue doesn't even require staff and customers to wear a mask.
So what we would say is the only reason maybe encouraged is used versus mandatory. It is mandatory, but we know that we have people who have medical conditions that cannot wear a mask, and you still can make accommodations for that person to enter your facility. I would say as far as our buildings, we are requiring individuals to wear masks. If you have seen someone not wear a mask, they probably put it on as soon as they step foot inside of the door, but I can't speak to that for everyone. But I don't know, Amanda, if you have anything else to add to that.
We want to know if compliance is not being achieved in any office or any facility that you're entering. So we definitely want that information, and we'll continue to provide the same follow-up. The encourage versus required, the whole masking issue in the state of Illinois, as many of you are well aware, has been a challenge. There have been several executive orders put forward regarding masking. There was a period of time where the order was put forward and the actual enforcement piece was not built into that order. And so there were concerns from local law enforcement and Illinois State Police and state's attorneys' offices across the state regarding the enforceability of that order. So we definitely don't want to be using vocabulary words interchangeably that are causing confusion. It is a requirement in the state of Illinois that people wear face covering when they're out in public, especially when they're not able to maintain 6 feet distancing. If this is not happening, then we want you to let us know, and then it would be our role to work with state's attorney and law enforcement to enforce that. And it is a two-way street. I can't stress that enough. Customers can call and complain about businesses, but businesses can also call and give us heads up if you're struggling with customers, so that we can figure out what we need to do within our system to provide you with support.
And what happens to a business if they receive that final warning, Amanda?
Okay, I'm going to let Michelle go over that. We do have a process that we're following, and we're just really urging you all to not help us get to that point. We don't want to have to put further restrictions on a business. So Michelle?
Theoretically, if anyone were to get to that point where we've exhausted all options with education and cooperation, and we know that it's not just one defiant customer, that it is actually being permitted by that business, we would refer that business to the state's attorney's office, and they would be given a court date. And from there, it would be up to the judge to decide what the next steps are, whether it would be a fine, if it would be something else, if it would be maybe another chance. But that would, we would kind of send it to, or we would definitely send it over to the state's attorney at that point. But like I said, no one has gotten to that point, and we hope to never get to that point.
And is that regardless of whether or not it's an essential or non-essential business?
No, it's regardless of that.
Thank you very much. One more question. Will there be trick-or-treating in Belvedere?
Well, I did want to let you know that the Chamber of Commerce is hosting a trunk or treat at Manly's on State Street there, and that will be from 4 to 6 p.m. on Friday, October 30th, and that's open to anybody. It is a drive-through model. It's safe for anybody that doesn't feel comfortable letting their kids out in the community. So that's another option.
And then Pam, I do have a question, sorry, on my end. Sorry, this is Heather. Kind of to Russ's point that he made earlier, you know, talking about, you know, how numbers have, or sales have reduced. So I guess my question is probably more to the businesses that are on the line on this call. What can the community do to support you going forward? What type of things are you looking for from Growth Dimensions, the Chamber, Health Department, just the community at large, that can help you navigate through this fiscally?
I'm not sure who that was. As a business owner, just letting the public know and getting the public out to come to the businesses. And I know that's counterproductive, because the health department, to make sure that we are down in our numbers, we want to make sure everybody does not get out and get exposed. However, on the business side, we've got to get some people in the stores, and to get back, maybe understand that takeout, we go back, you know, because our takeout numbers are slightly down, but of course our dining in is about as non-existent as it could be. So I mean, just goes back to support the local businesses. We again, when school started, we found that in our business, the numbers dropped dramatically. And I think it has a lot to do with the people just are not out. It's not like we're going to pick up the kids from school and stop by Sips and Sprinkles on the way home. Since they never go out of the house, that does not happen. Again, I think you still have a large percentage of people who are working from home. A lot of the offices downtown, I know the title company offices, the attorney offices, there's still a lot of those folks working at home. So again, as far as the local downtown businesses, it actually takes some real effort from the people to understand to come back, since they're not in town to start with and take the dinner home. You know, it turns out to be more of a destination. In our world, I think it's just the communication that everybody's open. We are trying our best. We are keeping everybody as safe as can be within the guidelines of what's going on. That's what we would be looking for. As far as help, administrative sides, the city has assisted. They've given us a couple boxes of masks. The Growth Dimensions, you know, and the Chamber of Commerce have all assisted to make sure that if a customer doesn't have one, we have one available for them. You know, in general, I think the Boone County has probably weighed very well in this altogether. It's unfortunate that our numbers have shot up. You know, and when we talk about shot up, I'm assuming we're not talking about thousands of people getting infected. We're talking about some very low numbers. However, since the county doesn't have a lot of people to start with, the percentages are high. So in that regard, I did have a question. Are we going to have does anybody know if we're going to have the Halloween parade?
We recently had a plan submitted to our office in regards to the holiday parade, which we approved. So as long as the people organizing that continue, then yes, there will be one.
Okay, well, that would be wonderful. Well, I do appreciate everybody's time and allowing us to voice some issues that we might have and just some good information coming back.
I wanted to address, there was one other question that was put in the chat about businesses being shut down while waiting for a court date if they reach that final warning. And what I would say is that there's actually two different types of warnings that would lead to that. You would have a warning for not practicing social distancing or being over your capacity limits versus a warning for not ensuring that people wear masks. So to be shut down would probably be more if you were disobeying being overcrowded, not practicing social distance between people who are not from the same household or group. So as long as that's not an issue, and we mean, you're over your fire capacity limit, if you have that would be a reason to maybe shut a business down, not a mass complaint necessarily, unless there was an extreme circumstance. So I just wanted to clarify that for the person who asked.
I'm not sure who's concerned about that. I will give you a little advice, whoever that is. Michelle has been into our establishments many times about people complaining for the last several months.
Russ, I think we lost contact.
But I just wanted to let that person know that that would be more of a decision of the court. We would only step into. Oh, Russ, are you there?
Lost my internet connection.
You're back on, Russ.
Oh, there we go. I was just going to say, whoever is having an issue or thinking that the business is going to be shut down by the health department, at the end of the day, the health department, and I don't know where I got cut off there, but the health department has worked with us in all of our restaurants and venues, and we have had as many complaints as anybody, I assure you, because we are dealing with, probably 500 or 600 clients a day between all three restaurants. So you're going to have some people, giving some complaints. However, Michelle has worked with us as long as we keep working with them too to try and better the situation. I do not think the health department is going to come into anybody and really try and put them out of business. You would have to do something, grievously inappropriate to have the health department come down like that. Again, I think that's true of any of the government agencies here. Everybody seems to be trying to work with everybody within the parameters of the rules that they have been that they have to work within, the guidelines that they have to work within. And I would let anybody who's listening understand that the guidelines that the government people have to work within are not guidelines that they put forward. They're just trying to enforce or have to work within the state's guidelines, and sometimes that's problematic. So give them a little latitude, and I think everything will be fine.
Thank you, Russ. Just wanted to keep it open. If there's anybody else that'd like to share with how we can help you in your business. Okay, well, thank you very much, everyone, for your time today. I just wanted to keep in mind that you can contact the health department at the number provided, and they'll be willing to provide you with some guidance and direction on how we can improve maybe the chances or lower the chances of any type of COVID exposures. And also, please know that you can get the information on Forward Boone, again, at www.forwardboone.org. And please let us know how we can help you. So even after today's event, we want you to reach out to us. The Belvedere Chamber is open to hear from businesses. Whether or not you're a member, they're open to hear from businesses, and they will share that with the Forward Boone group. We want to hear not only how we can help you, but maybe some recommendations if you want to share your best practices or any kind of concerns. So again, thank you all. I want to thank all our guests for joining us today and everyone that shared their comments, their concerns, and the strategies on how we could help reduce the chance of mitigation. Thank you.